Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. It's a special for me to be here to present my paper for all of you. Let me introduce myself. My name is Hasreni. I'm a nurse in Masih Public Health Center in Rekang, Indonesia. Okay, in this opportunity, I would like to present my paper with the title Psychospiritual Therapy in Post-Stroke Patient through Neuro-Linguistic Programming Approach. In this paper, I'm a second author, and the first author is Mr. Dr. Edi Rustan. Okay, why we choose this topic? Because as we know that stroke is the leading cause of morbidity and mortality in many countries, especially in development countries. And then stroke is a disease that is a burden on the world, for it can cause disability. Because of disability, there are so many changes in post-stroke patients while they are in rehabilitation phase, like change in independence, hope, and social relationship affect the psychology post-stroke patient. And then because of this change of psychology, there are it become a change in their health outcome, and then become a cycle of change for frustration. So for us, it's the self-acceptance. The self-acceptance is more important for nursing intervention. In this literature, in so many literature, we found that patients' self-acceptance can be increased through psychospiritual therapy. So many methods we can use to give psychospiritual therapy for the patient. One of them is neuro-linguistic programming. Neuro-linguistic programming can be used by health practitioners in changing patient behavior. But based on our preliminary study, we found that the recent study used neuro-linguistic programming approach for post-stroke patient. In giving the psychospiritual therapy for, so this our originality is using neuro-linguistic programming approach for post-stroke patient in giving psychospiritual therapy. Okay, so that's this study aims to first describe change in the psychological condition of post-stroke patient, and then second is describe the implementation of psychospiritual therapy, and third is find pattern of the application of psychospiritual therapy based on neuro-linguistic programming that are suitable for post-stroke patient. So to find these aims, we use method qualitative study using ethnography approach in the Buddhist community, and the subject were for post-stroke patient and patient's family, 3 nurses, 2 leaders, 2 traditional healers, and 2 clergy. Data were collected through observation and interview, and then analysis was carried out based on the Bradley model. And then the result based on 3 aims for our from our study. Okay, the first is change the psychological condition. The post-stroke patient find it difficult to accept change in their psychological condition, causing them become stressed to the point of despair. Is of course the change from their like a patient who are backbone feel very burdened with the limitation experience after suffering of stroke. And then the second is implementation of psychospiritual therapy. Based on our observation and our interview, we found that 3 types of service in Buddhist community for psychospiritual therapy. First is health practitioner. A practitioner provides psychospiritual therapy in the form of praying together with patients. Patients are invited to always remember God. For nursing itself, there are various nursing diagnoses that provide psychospiritual therapy, such as anxiety, sleeping disorder, or another else. And then is clerical service. It's provide therapy in the form of like Kia. And then the last is traditional healers or shamanic practice. We found that too many practice from the shamanic practice, such as mak baca-baca, mak kasih tanda ulaweng, or too many practice and others. And then find the pattern. Our aims is find the pattern of application of psychospiritual therapy based on neurolinguistic programming. As we know in second aims is there are too many practices in Buddhist community. So based on transcultural nursing, there are three types of culture uh, for the health. For the health, okay, is first is the culture following the health, or not following but not following but is not dangerous for the patient, and the third is not following and that's dangerous for patient. So for the first is we have two selection of patient habits that support health. It's based on transcultural nursing. And then is we anchoring positive suggestion. We can give positive suggestion by language and behavior treatment. It's and then providing education about stroke and worship materials, uh, and then involving patient in psychospiritual intervention. In this intervention, we we give the patient by there are three types service in the community. And then because of this intervention, we hope that there is self-acceptance increasing, so it can be giving positive self-concept for patient, and then they become wanna to get best health, like that. They wanna go to public health to get the health service. So our conclusion is this study described the finding in the form of a prototype that can be used by nurses in dealing with psychological change in post-stroke patient. Neurolinguistic programming based on psychospiritual therapy is carried out by combining neurolinguistic principle and habit that exist in society. Its implementation with first selection patient habit, and second is anchoring positive suggestion regarding the patient ability to pass all existing trials, and the last is patient were given education and involved in worship activities. I think that's all from me. Thank you very much, and assalamualaikum warahmatullahi wabarakatuh.